Hello, welcome to another one of our videos about pelvic health. Today we're going to be talking about the pelvic floor muscles, and you're definitely going to do all this video.
I'm going to do all the
yeah,
talking.
because
Here I go.
this is your bag.
Solo.
Yeah.
Alright, you've got to help that Rose.
Okay.
All
I
right.
hope you.
Help me?
Yeah.
Okay. Pelvic floor muscles. So what are they? They are an amazing stretcher. They're a group of muscles that sit at the base of the pelvis. So if we think about the pelvis, the bony part as being like a bowl, we've got all our organs in here, so our beautiful fruit sitting down in our bowl, and the bottom of the bowl, the base of the bowl, is actually muscle. So the pelvic floor muscles, if we're looking up into the pelvis, you can see the ones that sit more so on the outside. There's lots of layers of them. If we look in, we can see the deeper layer as well. So there's a whole lot of muscles that work together there, and they go out in all sorts of directions. Now, through the pelvic floor muscles, we have the tube from the bowel come down. We've got the vaginal opening. We've got the tube that comes down from the bladder as well, and they pierce through there. And that's important to know because the muscles
You pierce through there.
Yep, you do. Thanks. And do poos and farts. Yeah.
You said pierced, didn't you?
Pierced, not pissed.
Yeah.
So when the muscles wrap around there too, they help to give us control over passing wind, doing wheeze, doing poos, and it also affects the vaginal tone, so the sort of the amount of closure that we've got to the vaginal opening. But the pelvic floor muscles, they can pull on like any muscle system can, and they need to be able to relax as well. In this video, we're not going to be talking about pelvic floor muscles that don't relax well. We'll talk about that separately in a different video. Okay. So with this group of muscles, we can tell them to pull up and in, and they hopefully will follow our prompts and what we ask them to do. We can ask them to relax. They also will come on reflexly, so we might go to cough or sneeze, and we don't necessarily think about pulling them in. They will actually, to a degree, come in and close all the doors down below, so we don't leak. Don't have things come out that we don't want to.
It's good.
Yeah, so they're a great group of muscles.
Yeah, they're pretty necessary.
Very much so.
Yeah.
So they keep us social, they keep us comfortable, they do lots of great things down there. The pelvic floor muscles, because of where they sit though, they can really undergo lots of pressure and damage through life. But also with where they sit, a lot of us don't know anything about it, and we've never been sort of taught about them or talked about them because they're down in that embarrassing area. And you know,
the shameful area.
Don't go there. So we don't know enough about them. So, you know, as young women, young men, we really don't know that our pelvic floor muscles exist till maybe we have a baby, or you know, for men too, it's usually when their prostate falls apart later in life. So we need to talk about these things. Really important. So normal function.
Good.
What they do.
Yeah.
What
Well,
do they do?
I think like you alluded to, they're there, you know, turning on, contracting, and but also relaxing, and that. So part of their function is holding things in. So what they do is, when you said keep us social, so for poo and farts, we want to let them out when we can and when it's appropriate, and hold them in when it is not appropriate to be pooing and farting. And same with our bladder, so we want to be able to hold urine in our bladder until it's a suitable time to then relax and empty. So our pelvic floor is involved in that, and then our pelvic floor is involved in sex. So you know, we need to be able to relax and contract to enjoy sex fully.
And have a better orgasm.
And
what about keeping our fruit in?
We want to keep our fruit up in the bowl, not be dropping our fruit out of the bowl.
Absolutely.
For sure. And I guess as well, just for, you know, other little extra bit would be about sometimes we need to have medical procedures or things that might involve us being able to relax our pelvic floor to, you know, either have have a test or an examination like a pelvic ultrasound, or to have a pap smear or an examination of the cervix for another reason, or an insertion of an intrauterine device for contraception. So that can be, another reason that's helpful to be able to relax our pelvic floor, and also with thinking about period management, whether we're using tampons or menstrual cups and things like that, they can be really helpful management tools for periods, and being able to put them in requires you to be able to relax your pelvic floor a little bit to get them up and in there. So yeah.
Great. So with the pelvic floor, we can make it stronger. So even if we've ignored it most of our life, it's not too late to actually do some exercise. But on the other side of things, the sooner we can start doing exercises for this muscle group, the better the function's actually going to be.
Yeah. So you're saying whilst I've been really lazy, I should get on it sooner rather than later. But it's never too late.
It's never too late. No.
Good.
We're going to start now.
Okay.
So Rose and I are about to do some. Oh, you beat me. All right. So when we actually use our pelvic floor muscles, we want to pull up and in as though we're trying to hold in. Yeah, but we don't want anyone to know it from the outside. Because otherwise we can't go out for coffee.
I can only hold my breath for 30 seconds. So.
You've got to breathe though, Rose. Sorry. So, alright, we're going to get comfortable. We can do the mini position. We're going to pull up and in. Hold a wee.
Pull up.
Pull what? Pull those muscles.
Oh yeah, pull
so
what up.
Pull up and in around your bladder opening as though you're stopping the wee coming out. Hold on to that. Pull up around your back passage and hold in a fart.
Yeah. All at once.
All at once,
Yeah.
because we can multitask. We'll get to breathing in a minute.
Okay.
And you're going to suck up through your vagina as though you're pulling something up and in.
Okay.
So that gets the whole pelvic floor working. And we want to keep breathing as well. Because in normal day-to-day life, when our pelvic floor works, we've got to be able to breathe.
It's
funny.
funny.
Yeah, good girl.
Although
So
I would say that thinking about all of that is quite difficult, but I imagine it gets easier with time.
Absolutely.
Yeah.
It's like any new skill that we're learning.
Yeah.
We do some practice
Yeah.
and we get better at it.
Yeah.
And we can then multitask while we do it.
Yeah.
And we get stronger as well. Now,
Yeah.
you let yours go?
Yeah.
Yeah, good. So excellent. Well done. So from a pelvic floor muscle point of view, some people are not sure if they're doing the pelvic floor muscle squeezes correctly.
Yeah. It can be really tricky, can't it?
Absolutely.
To know if you're doing it right.
Now, was that technique you did first of using whole body experience? No, Rose. So getting someone to assess your pelvic floor muscles can be really useful.
Yeah.
And they can then tell you how strong your pelvic floor is, how long you can hold for, how quickly you can bring it in, can you relax it fully. Lots of different things that can be assessed.
Yeah, so that can be really helpful to see someone about it.
Very much so.
Yeah.
And not everyone wants an examination as well, and that's fine. There's other tools to be able to work out what the pelvic floor muscles are doing, and then be able to give you a program to strengthen that muscle group up.
Yeah, so that's good to know. Okay.
So when we think about the strength of the pelvic floor, we want it to be strong so that it can pull in and give good closure to all the openings down below.
Yeah.
And that way it can hold organs in, holds in our farts, holds in our wheeze. So that's a strength component.
Yeah.
The endurance side of things is about being able to hold in over a long period of time. So that's going to be important too, because we might be a long way away from the toilet and we've got to hold in a wee or hold in a poo and be able to hold on long enough to be able to make it. The other side of that too is the pelvic floor muscles need to work over a long period of time while we're awake during the day. So they've got to be able to hold on with a certain degree of activation there in that muscle group so that our fruit doesn't fall out.
Yeah.
So that we prevent a prolapse. And pelvic floor muscles, unlike other skeletal muscle, which is muscle that we can strengthen, which will get weaker when we don't actually exercise it, that the pelvic floor muscle never turns off completely. Whereas other skeletal muscles in our body, like our biceps and our quads and stuff, that will turn off and rest. But the pelvic floor muscles can't do that.
No, thankfully.
No, absolutely, because we have an absolute puddle
down
below.
Yeah.
So we need that endurance. And we also need speed because we need the muscles to be able to come on quickly and be able to close all the doors if pressure's hitting before they actually open and stuff starts to come out.
And is that speed, is that part of the muscle itself, but is that part of the pathway, like between, like is that to do with your nerves as well?
Well, very much so, because any muscle has nerve input, which is then telling it what to do.
Yeah.
So when we actually start a pelvic floor muscle program to get stronger, so I often call it the vagina gym that I send people to, or if we're looking at a male pelvic floor, we go to the penis gym as well. But when we're actually looking at programs that we put together, the first part of any training program is actually about nerve change. It's about how the nerves actually talk to the muscles.
Yeah.
And that might be a 2-week process that really you're getting a whole lot of nerve change. And then from then on you start to get more muscular change as well.
Yeah. So you've got to be able to like communicate with that
You
muscle.
do. Got to be able to
Before the
talk to
muscle
it.
can do the thing.
Yeah. And that's where you've got to know where it sits, how to actually contract it as well, but how to relax it.
Yeah. So getting a bit of feedback about when the muscle is doing what you want it to do, to reinforce that is the right signal that you're giving it is really helpful, isn't it? Sort of
Very
like
much so.
closing the circle, isn't it?
And if you're not sure that you're doing them correctly, or if you're actually doing them incorrectly, it could actually cause more problems than be able to improve things.
Yeah, this might, or just not make the headway with
Or,
it
yeah,
at
not
all,
make any
make no
difference.
difference.
Very much so.
Yeah. Cool. Thanks, Lisa.
Thanks, Rose. High five.